Okay, so first we're going to go ahead and verify the physician's orders, make sure that he ordered a Foley insertion, and then later on we'll be doing the closed specimen retrieval as well as Foley removal. So we verify the physician's orders. You're going to go ahead and gather your equipment. You're going to enter the room. You're going to wash your hands. You can also don gloves at this point. You're going to identify yourself to the patient, also identify the patient. So I'm going to say, "Hi, Mr. Smith. Can I ask for your first and last name and your date of birth?" And then he verifies that. So I'll say, "Okay, so I'm Brian. I'm going to be your nurse today. I'm just going to go ahead and the doctor ordered actually for us to do a Foley insertion. Okay, do you have any questions?" And he indicates no. At this point, I'm also going to simultaneously be checking if the table is locked, but also ask him, "Do you have any allergies to iodine or latex?" And he says no, but if he did, I would then have to call down to Central Supply and have them send up the appropriate equipment that I could work with this patient. So I'm going to go ahead and provide for privacy, so I'll close the curtain. I'm going to raise the bed to working height. This way. Go ahead and lower the side rail. I'm also going to ask the patient if he's comfortable. Are you comfortable like this, or would you rather be flat, or if he's going to stay like this? So then I'm going to go ahead and undrape him. Now we're going to do what the fan fold technique. We go down here. Also, but this is a female patient, so we'll go Mrs. Smith. So it's going to undrape her here. You can also, if they're uncomfortable or chilly, you can also go ahead and put a blanket on their top here, as well as maybe their lower extremities if they're cold. But I'll go ahead and set that up there. I have my kit here. I'm going to bring my table closer. I'm going to go ahead and take the outer bag. This is for trash. I'm going to go ahead and place this over here. And again, when you're here, you can also look at your Foley packaging, check the label, and see what size catheter. Usually you'll be using the 16 gauge catheters or the 16 French. So here it does say 16. But I'm going to go ahead and bring my kit over here. Again, when you're practicing sterile fields, you want to make sure that you're opening away from you. So here, this opens here, here, and then actually technically this is wrapped differently, but it would have been away from you there, and then either left or right, whichever's on top. And then down.
So it's okay if it's touching the blanket?
Well, the blanket, I guess I should, yeah, I'll have that more down here. But so we'll start over here again. So with this being open, you open away from you, and then whichever's on top, and then bottom here. So this should stay down. Of course. Sorry, as I'm reaching over, this is not what you're supposed to do, but so that's there. Then you have the option, you can actually kind of you can step over here and kind of square it up. This would stay down. Squared up to here. Again, you want to be working with your 1-inch margin on all the pads, so we're just going to make sure you're touching the edge there. And I'm going to go ahead and reach for the chuck here, and you want to open this. Again, a 1-inch margin. So if the patient's able to, you're going to ask them to go ahead and lift their behind, and that way you can go ahead and put this underneath them. But if not, you just lay this down. You don't want to play with it too much. You just leave it there. You don't want to contaminate anything else, and leave that there. Now you're going to go ahead and apply your sterile gloves. So this we have here, grab from the outside. You're going to go ahead and apply this to open. And you can just grab here, out. Never stays. I should apply this out before I put the audition. Does yours not stay?
Mine's super used.
Oh, okay. Mine's like that, so mine's super that one. Okay, so this technically would be flat there. So I can remove these gloves. Garbage. Now I'm going to go ahead and use sterile technique to put on these gloves. So you can go ahead and I can actually pinch the outside here, right? I think so.
Yeah.
These are small. I guess I'm good at practicing with it now, right? If I'm doing anything really wrong with this, you can obviously tell me. So these gloves are actually like, I think it's small. Sorry, this you do not do. But, so pretending that these would fit easily. I'll get this glove on. You see how small these are? Okay, so technically I'm not supposed to do this, but here. So this should slide on, right?
It's not one size fits all.
It's not one size fits all. Okay, so that.
Don't poke a hole in it.
Yeah. So this is sterile. I wouldn't have been touching like that. And you can go ahead and use your 2 fingers, and you can go underneath the cuff here. And you want to have this right there. So then you have your thumb out.
When I did that, I put the thumb in the pinky.
You put the thumb. You did. Oh.
I didn't know which side was the thumb at first.
It's not bad. Okay, so then this goes here, and there. And I think I can pull out. I can pull down here, right?
Yeah.
Okay. As long as you're touching the outside, which is still sterile. Now that's set. So this is. You can go ahead and throw this away as well. Or you can leave this here for sharps, whatever you want. So I'll put it there. But actually, I'll leave this for sharps. So I'll put this over here. Now go ahead and take the guard. Again, you want to make sure that you're doing the 1-inch margin kind of around. And then when you're here, you want to kind of grab the outsides here, and fold it away, and there. There. And so now this is all sterile.
It's not aligned.
It's not. Don't laugh. I'm not supposed to adjust that either. So technically, my first one, I should have gone right. Oh god. There and there. That's fine. That's fine. I can work with
You
that.
can like tap it down. It's sterile.
Yeah. So yeah, because you're glad it's there, yeah. So you can actually do that. Okay. There. So now we're gonna go ahead and we can adjust the box. The kit. We can take the kit out here and put it right there, just for ease. I'm gonna go ahead and take the iodine. I'm gonna go ahead and put it on my cotton balls. Oh, is there? There's tweezers.
Those are sticks.
Oh, these are sticks.
Yeah.
Oh, okay.
So
Well, pretend this is iodine, and then you pour that onto your. What do I have to do for a clinic? We'll pour that onto the cotton balls, and then that goes into the garbage. Then you're gonna go ahead and take the lubrication. And you're gonna remove the cap, throw it away, and you're gonna go ahead and fill up this tray over here. And this gets used or put in the sharps pile for the sharps container. Then you can go ahead and take out your Foley catheter here. Here. Just lay that over here. Now again, everything is still sterile, so you want to make sure you're not reaching over unnecessarily. So at this point, what you can do is, when you're removing this, you want to make sure that you're stabilizing this side because you don't want to be flaring the catheter around. So when you're taking it out, you just want to make sure that it's all not flaring around. So that is garbage. Now we have, then you can go ahead and take your 10 cc's of water. Usually use 10 cc's to fill the lumen, sometimes, or the lumen, the bubble, or sometimes some of them are 6 cc's. This one's 10. So I can go ahead and remove the cap. And then go ahead and insert it into here. And then I'm going to place this down, and I'm going to put this end into the lubrication that I filled up in the tray. That usually should be a little more smooth. I should not have touched that either. So don't touch this box after you have your gloves on. Okay. So that's all set, right? So now you're going to go ahead and use your tweezers. I don't have tweezers on me, so I'm going to pretend I have tweezers here. So I'm going to go ahead and take one cotton ball. You're going to then wipe the distal end of the labia. So it's over here.
Hold it apart.
Oh.
You have to spread the.
Oh yeah. Oh yeah. You're right. Sorry. So this is your now. This will be your non-dominant hand, which now once you touch the patient is no longer sterile, so you can't move it. So you're going to go ahead and spread the labia. And wipe the distal labia over here on the outside here. Throw this away. You're gonna wipe the proximal side here. Throw it away. And you're gonna go ahead and straight down the meatus in the middle to clean the meatus as well. So 1, 2, 3. And while you're doing this, you also want to be watching the meatus in the shouldn't have been double wipe. It's a one wipe here. But while you're wiping in general, you could be possibly stimulating the urethra as well, so you might see that moving, which will help you narrow down where the urethra is, or the meatus opening. So now this is still your sterile hand, your dominant hand. So you're going to go ahead and take the catheter, and you're going to go ahead and progress in about 3 inches. Am I missing anything so far? So here you usually put it into the meatus or urethra, but on a mannequin you can't do that. So we're going to go ahead and put it into the vagina here, but that's for validation purposes. So you're going to advance about 3 inches. You can also be making sure that you're monitoring the catheter to see when urine comes out. Once you hit the urine, you're going to advance it another inch or 2. And then when you're in there, to make sure that you're in the bladder, now you're going to go ahead and hold here. and then you can to stabilize this. You can no longer advance any farther because this is not sterile. And then you're going to go ahead and inject the 10 cc's into the lumen. Once that's all in there, you can actually give that a tug and make sure it doesn't come out. And you go ahead and now you can, you can go ahead and remove that. You want to make sure also before you remove that, you always keep this on there with your finger on the plunger, because otherwise the lumen can push back into the syringe. This gets thrown away into the sharps. And then you go ahead and you can gather your equipment. And I would technically take all this away. This will go ahead and get thrown away. This would get thrown away. You want to go ahead and also hang the Foley bag onto the bed frame, not the bed, not the bed rails.
Yeah.
So that moves up and down. So we're going to go ahead and watch that there. You also want to be watching this as it's filling, and you want to stay with you want to monitor it for the next 30 minutes or so, 30 minutes, just to make sure it doesn't go over 800 milliliters, because that means you're deflating the bladder too quickly. If it was going that fast, you'd want to kink the tube slightly just so it's not overfilling or not draining too quickly. This would also technically would be removed. You would re-drip the patient. I'm not doing that right now because for validation purposes, we're going to go right into the specimen retrieval. But yeah, you'd remove this, you'd re-drape them, you'd cover them, you'd make them comfortable. You would lower the bed to the lowest setting with the arm rail up, make sure they're okay. Make sure you do the call bell. You would then go ahead and throw your equipment, remove your gloves, wash your hands, and then you would document. You'd also then look at how much urine was coming out. You get the quality of the urine, or the output. You'd also the quality, if it was yellow or amber or clear, and then anything else to that one? I don't think so.
The time?
The time that you put in. Oh, and also that it was 16 Foley or 16 French Foley, as well as that you inflated it with 10 milliliters into the lumen, to the bubble. And then that's how you do the Foley insertion. Again, when you leave the patient, they'd be covered and draped in lowest positioning, call bell, and then documentation. So now, anything else you can add to that? I don't think so. So now we're going to go ahead and do the specimen retrieval. So technically, also when you're doing the specimen retrieval, if the doctor wanted it, you could do it with up to an hour of insertion for the Foley directly from the bag. But in this case, you're it's past that. So you have the physician's order. They want you to take the specimen from a closed system method. So check the physician's orders. This is not on right now. Put this here. So check the physician's orders, gather your equipment. You're going to enter the room. You're going to wash your hands. You're going to verify the patient as well as yourself. So actually, this would have been up, but so verify yourself. Oh, thank you. Let them know the procedures that you're doing. And then after any questions, and again, it's always good to double check if it's a different patient, if they have any allergies to latex, if you're wearing latex gloves. So you have your latex gloves on now, or you have your gloves on. So for this procedure, you would need a sterile syringe, a sterile specimen container, a pad or a chuck, and then alcohol swipes, or alcohol swabs. So you're going to go ahead and raise the bed to your working height, provide privacy, make sure the bed's locked. Raise the bed working height, arm rail down, and then you're going to go ahead and undrape the patient. Actually, before you do that, you're going to go ahead and also then kink the tube for 15 to 30 minutes because you need the sample to be fresh. So here, if you don't have a rubber band, you could use, if they don't have a clip, they can use a rubber band. But you want to kink the tube, and again, you want to wait for about 15 to 30 minutes for this. So let's say that's there. So let's say the 15-30 minutes are up, and then you come back again. So you'd be here, hands washed, gloves on. You're going to go ahead and take, so now this would be in theory a clear table. So here, so you have a specimen, the sterile specimen. You also can put down, let's say, a piece of paper towel here on the table just to keep it clean, or just another barrier. You have alcohol swipes. So 15 minutes passed. You're going to go ahead and take your alcohol pad. Go ahead and scrub the hub.
Oh,
And you want to go ahead and take the sample. And you can go ahead and also scrub that up again if you like. prior to this, you could have also then opened up the sterile specimen container, but in this point, we're going to do it right now. So open the specimen container, you make sure that you put the cap up, the bottom part up.
Do we need a pad for this or no?
Thank you.
Okay,
So we're
I don't know.
winding. I should have put the pad down here. So after that initial 15-30 minutes, you want to put the pad underneath where you'd be putting in taking the sample. So that's there. And again, this is clamped, so then you go ahead and take the sample. We'll do that part again. So chuck down, put it in here, take the sample, remove. Now this is open, and you want to go ahead and put this into the specimen container. Close that. Then I'd already wiped this again, so at the very end I'd probably wipe it one more time. I'd then remove all of this, the chuck again. This again in theory wouldn't be here because that was from the previous validation or insertion. Then we'll go ahead and take this away, throw it away. We'll make sure to unclamp this as well. So that was removed. And drape the patient. Make sure that they're comfortable, lower the bed to the lowest setting, put them on the arm rail, make sure they're comfortable. If they have any questions, go ahead and then you're going to go ahead and remove your gloves, wash your hands. You're going to label this with the patient's name and how much you took out, and then you're going to wrap it correctly into the proper the proper containers for specimen analysis. So that's done with the specimen retrieval. Now we're going to go ahead and take the Foley out. So we're going to go ahead and check the physician's orders, make sure that he ordered the Foley removed needed. So you're going to go ahead and gather your equipment. In this case, you're just going to need a warm pad just to wipe the area after when you're done. You also want to have the, what's the other thing? Oh, no, sorry, then the chuck as well, just in case there's any mess. And then that's it, actually. So you're going to go ahead, and the syringe to remove the lumen. And again, if you check your original order, you can see how much the lumen was filled in when you documented originally, but if you forgot on the Foley itself, it does say how much was filled in, how big the lumen is or the balloon is. And we're going to, and it's 10. It's supposed to say it on here somewhere, but it doesn't. So, oh yeah, 10. Yeah, so 10 milliliter right here. So you can go ahead and bring a 10 milliliter in the syringe. So you take the 10 milliliter. So you're going to go ahead and enter the room. We're going to wash your hands. You're going to identify yourself to the patient. Identify the patient. Tell them what you're doing. Ask them if there's any questions. Again, if you haven't dealt with this patient, you want to verify if they have any latex allergies. And then you're going to go ahead and raise the bed to working height. Provide privacy. Make sure that the bed is locked as well for the rail. And you're going to go ahead and undrape them. You're going to go ahead and put the chuck down. Again, you can be wearing clean gloves for this procedure because it's no longer sterile. So there is the pad there. You're going to go ahead and remove the 10 milliliters from the original thing. And while you're doing this, you also want to stabilize the catheter itself, because when it is draining, it will flop out. You want to eliminate any excess urine flying around. And that'll easily come out here. Excuse me. So then again, so when you're here, then you want to go ahead and kind of wrap this around. You can remove this for putting into the sharps container. And then you can go ahead and wrap here. And you can also remove the catheter. Now at this point, you would then remove your glove here.
Look at the drainage.
I know you do want to look at drainage. That's why it is kind of weird. I probably would have looked at the drainage first initially. Yeah. So you want to try to wrap this over here. I'll probably do that over there.
It's hard.
It is hard. And then
she couldn't even do
well,
it in the video.
Oh, you know
She
what it is?
couldn't do.
I think maybe it's just a tube. Hold on. So pretend you're holding here. Let's put this back on. Just the catheter part, the green part. This is not so smart. Okay, so pretend that you had just pulled out the catheter. Right, so it's here. So then you just go like this. There, I think just like this. And then you can wrap it like that.
Okay, that makes sense.
Yeah. And then go here. Now, I guess technically, I mean, in the real world, I think you do this in the very beginning, but you'd also want to look at the drainage here and measure how much it is, document that as well, take note of that. And you can go ahead and empty this into a urinal or the toilet bowl, and then go ahead and throw this part away into the proper receptacle. Now you want to make sure, then you can have that warm pad that we talked about. You can also wipe them here, and then you can also, if there's any, especially if there's any spillage, you're going to get rid of this material here. Garbage. You're going to go ahead and cover them there. You're going to now retrape them. Arm rail, lower the bed, ask them if they have any questions, how they're doing, if they're okay. Make sure the claw bell is within reach. That's all over set. Now again, you already had all your material here. You throw everything away. You wash your hands. And you then will document again the output, what time you took it out. Again, you took out a 16 French a French catheter Foley with 10 milliliter balloon.
Oh, also, if you notice any signs of like infection or virus.
Yeah, and anytime you're documenting, always make sure there's any signs of infection. Also, actually going back to the very beginning, when you're inserting, also the tolerance of the patient, if they're able to take in the catheter with ease, or if there's any resistance, and anything pertinent that would be important to the later on procedures. And then yeah, I believe that's it. And that is how you do the insertion, specimen, closed system, collection, and then the removal of the Foley catheter. Thanks for watching, and Abby's over there.
Well,